I'm in my 50th year of practice that spans most of the second half of the 20th century, but North Brookfield has a medical and historical treasure dating back to 1911 in Jeanette Howland, a 1929 graduate of North Brookfield High School and Hanneman Hospital School of Nursing graduate in 1933. Jeanette worked at Mary Lane Hospital for 32 and a half years from 1946 until 1979, and then started a new career at Old Sturbridge Village and has been there for the past 25 years. Mary Lane Hospital's origin was when the Ware Social Science Club sponsored a visiting nurse in 1903 and established a hospital in 1909, where Valley Human Services is now on South Street across from today's Mary Lane Hospital. In 1919, the Gilbert estate was given and endowed with $500,000 to build and support the hospital, and it was named for Mary Lane Gilbert. When I started at Mary Lane Hospital in November 1955, there had been one addition to the original building, and the carriage house of the estate was still on the grounds. At that time, Jeanette, as evening supervisor, did everything but cook the evening meal. She was the laboratory, x-ray, pharmacy, emergency room, and delivery nurse, and spent time with the families of all dying patients. She also went out on ambulance runs in the old hearse that was the ambulance at that time. I don't know, but she may have driven too. Just to go back for a moment in history, Jeanette first met me a couple of days before I was born at a card party at my home put on by the high school junior class, of which my sister and Jeanette were members. No one knew my mother was pregnant until my sister announced she had a baby brother. My mother was plump enough so that I didn't show myself. Among doctors who practiced before my time in North Brookfield were Dr. Philly Brown, who lived on the lower end of Summer Street. He was the stepfather of two Murray girls, one of whom was to become Mrs. Evelyn Rooney. Dr. Prouty lived where Dr. O'Boyle lived and practiced. His son was killed during World War I, and the VFW in North Brookfield I knew who spent their whole careers here were Dr. Emerson Ludden, who lived where Langevin's auction barn is. The Benvenuti family lived there after Dr. Ludden, and Matt Benvenuti found Dr. Ludden's medical school graduation class photograph from Albany Medical College and his Board of Registration in Medicine certificate in the attic of that house. No licenses were required to practice medicine until 1894, and Dr. Ludden started practicing in 1888. The Board of Registration in Medicine was established in 1894, and Dr. Ludden's certificate is a first-year issue. A copy of the law establishing the board was obtained from Senator Brewer and is on display. Having been in practice at least 3 years prior to 1894, Dr. Ludden was issued a certificate for the fee of $1. He vaccinated me, and I must have had a tight shirt sleeve because my scar is about 2 inches above the left elbow, and normally they were about 2 inches down from the left shoulder. Dr. Kent Royal came to North Brookfield in the early 1920s. He was a graduate of Harvard and trained in West Virginia, where he met his wife, who was a nurse working in the hospital. Mrs. Royal was from Pennsylvania. They had 2 daughters, Betty Ann in my brother's class, Janet in my class. They first lived on Summer Street near the Savings Bank where Melvina had her beauty shop. Then he moved to Dr. Witter's house at 119 South Main Street. In later life, he lost a leg and retired from practice. Dick Fulham designed and built a house for Dr. Royal at the corner of Gilbert and Grant Streets, all on one floor without thresholds to cross, and was easier to get around in. Dr. Thomas O'Boyle came to North Brookfield around 1933 and lived and practiced in Dr. Prouty's house at 228 Main Street, across from Cumberland Farms. Dr. Prouty's name may still be etched in the fancy glass front door. Politics kept Dr. O'Boyle from practicing in the hospital for many years, during which he had a very busy practice and did many home deliveries. During the flood and hurricane in 1938, he was driving his nurse, Mrs. Woodis, home after a delivery, and they were at Doan's Pond when the dam burst and Mrs. Woodis was washed away by the rushing water and drowned. Dr. Lewis Roy practiced in Dr. Royal's office on South Main Street and then moved his practice and home to West Brookfield. He was a history buff and wrote a book about the Quabog plantation and medicine in early American times. He also was the doctor who started the Barry Health Center, which is a major teaching unit of UMass Medical School for training of residents in family practice. Other doctors who were here for a while: Dr. Hostetler. For the short time he was here in the 1930s and 40s, lived in at least 4 different locations, and Jeanette says there may have been as many as 6. One was on Spring Street, right behind the Episcopal Church. One was on School Street, across from the depot. One was on Gilbert Street, at the corner of Cushing. And finally, on Summer Street, where Teresa Lemia lives. And then he moved out of town. Dr. Robert Bush was in North Brookfield for a few years in the late 1940s and early 50s. He first lived in Paul Burnham's house across from the VFW, and then he moved to the Wilbur House across from the Catholic Church. Then he moved his practice to Northborough. He had a brother James and a sister-in-law Cecilia who both practiced in Munson. I knew them from Mary Lane Hospital. Dr. Haywood practiced in East Brookfield. Shortly after I arrived, I made a house call on an old gentleman who took one look at me and demanded to know where Dr. Haywood was. Growing up in North Brookfield in the 1930s and during World War II, in addition to helping with farm work like feeding chickens, picking apples, and hoeing sweet corn, I took violin lessons for 7 or 8 years. On Saturdays, when other kids took off for the woods or fishing, I was off to Worcester for my lesson. Boy Scouts was one of the few group activities then, if you weren't good enough for baseball or basketball. Among the various merit badges to become an Eagle Scout are first aid to animals, and public health. Coming from a small school like North Brookfield, I'm sure that being an Eagle Scout helped in my getting accepted to an Ivy League college. My mother always bought things too large, and here, 61 years later, I can still fit into my Boy Scout uniform, which is on display. When I was in high school, I wanted to be a veterinarian, not a medical doctor. I spent some time with Dr. Windsor Smith, Jeanette Howland's father, who lived on Grove Street across from the asbestos plant. There were only 10 veterinary colleges in the country then, and none in New England. I went to Cornell in Ithaca, New York, hoping to get into the New York State Veterinary College at Cornell. But by the time I finished my 1 year of required pre-vet, World War II was over, and all the veterans with the GI Bill were coming home, and it was impossible to get accepted. I joined the Army in October 1946 for 18 months, hoping that when I got back, I might have a better chance. that was not the case, and I continued with pre-med courses, and after finishing undergraduate work at Cornell, I had no problem getting into medical school and haven't regretted the change in careers. I've had horses, cats, and dogs all my life without being their doctor. Dr. Royal put in a good word for me when I applied to Tufts Medical School, where the dean was a classmate of his. My first choice for internship was Tripler Army Hospital in the territory of Hawaii. I spent a year there at the 2,000-bed hospital that served all the armed forces, veterans, and public health service for the Hawaiian Islands and all of the other Southwest Pacific U.S. territories. Tripler was my first choice for an internship because I didn't want to visit Hawaii in my retirement and say that I wish I had spent my life there. The 1 year was excellent training, but I knew I wanted to return to North Brookfield. On September 22, 1955, I got my Massachusetts license and officially saw my first patients on September 29, 1955. The first day, I saw 4 patients. It wasn't until years later that I learned 3 of them were each given $3 by my father to come and see me that day so I'd have some business. Today, those 4 patients would probably all go to specialists, one to an obstetrician, one to a cardiologist, one to a geriatrician, and one to a psychiatrist. Some years there wasn't a single case of anthrax in the whole United States, and I had a case in my second week of practice. This would certainly be handled by an infectious disease specialist now, and the state and federal government would descend on North Brookfield. Even then, the Massachusetts Department of Public Health tracked the case. I would never have diagnosed it if the patient didn't come in and ask me if I thought the sore on his arm was anthrax. Signs at the Barry Wool Coating Company warned workers that if they had a sore that didn't heal, they should be checked for anthrax. Raw wool was a carrier of anthrax spores. A cutaneous or skin lesion type anthrax is not the feared deadly kind that is the threat of biologic warfare today. In my second month of practice, I had 2 cases of severe croup, 1 week apart, that required tracheotomies because the upper windpipes were so swollen their breathing was completely obstructed. I had never seen one done because they were usually done as emergencies in the middle of the night, and when we came in the next day on rounds, we would see the tracheotomy tubes in place. I had no choice but to do them. It's very gratifying to see these children take a breath once the windpipe is opened. One of these children moved to California, and several years later, on a visit back to North Brookfield, I saw his father, and I asked how his son was doing. He said, "Fine, but will that scar ever go away?" I had to bite my tongue to keep from telling him that we could have buried him without the scar. Tracheotomies are rarely needed now because of the proficiency and skill of EMTs and emergency room personnel in intubating, passing a tube down into the windpipe without making an incision in the throat. The Pope had a tracheotomy in January for his severe respiratory problem. My office was at the corner of South Main and Bates Street from September 1955 until June 1956, when I moved to North Main Street. My home and office were together in one building until July 1963, when I moved the office to a separate building next door and incorporated the empty office space into more home living quarters. In 1996, I sold my practice to the Fallon Clinic and continued to practice in that office until June 2003, a total of 40 years in that building, when the practice was moved to the primary care physician's Fallon office in Spencer. Dr. Tim O'Connor, who took over Dr. Clarence Pram's optometry office, moved into the building on North Main Street. I didn't get my interest in obstetrics from my father. He used to peddle apples from his orchard, and once at the far end of Ocam on a dead-end road, he stopped at a house where the lady, obviously very pregnant, came out on the porch. Making small talk, he asked when she was due, and she said, "Any minute. I'm having 5-minute pains. This is my 5th baby, and they come fast. My husband is in Boston, and I can't reach him." This was in the days before cell phones. I think the Conant sisters still owned and ran the Ocam Telephone Company, one of the last private companies in the state. My father could have offered to take her to the hospital, stayed with her until help arrived, prepared for an emergency delivery, or fled the scene. You guessed it, he took off. I had enough training in medical school and internship to be comfortable handling most deliveries. No one practicing at Mary Lane Hospital had obstetrical training beyond internship, and I was doing more and more deliveries. So I took off a year for an obstetrical residency at Providence Lying-In Hospital, while continuing to keep up my practice 2 nights a week and every other weekend. That year enabled me to do cesarean sections for my patients and to serve as consultant to other doctors who one by one were giving up obstetrics. My practice grew to as many as 200 deliveries a year, which is a full-time practice for some OB doctors, but I also carried on a full office practice and covered 2 14-hour nights in the emergency room at Mary Lane Hospital for 16 years. When I started my practice in 1955, my mother referred to obstetrical patients as confinement cases. It used to be that pregnant women literally confined themselves once they started to show. They weren't in evening gowns, bathing suits, or on the cover of magazines like they are now. Obstetrical deliveries by Dr. O'Boyle at home and by me in the hospital were not all that different. In fact, there was a growing movement to return to this simpler and less interventional type of maternity care, especially by some midwives. Care by doctors and nurse midwives in the hospital setting are highly technical now, with genetic counseling, ultrasound, fertility studies, cesarean section rates at 25% or higher, all with the goal of all deliveries resulting in perfect babies. This is an unrealistic goal. Adding up deliveries from medical school, internship, residency, and practice, my total deliveries is close to 5,000. 2 years ago, a 25-year-old woman was in my office, and she said she had been talking to her mother, who figured I must be well into my 80s because I had delivered the mother 47 years earlier. She probably thought I was 37 or 38. At that time, plus 47 would make me 84 or 85. I actually was 28 years old at the time of her delivery. Medical ethics in 1955 was much different than today. In order to be admitted to the medical society, I had to appear before a board of censors. The number one question and the answer they were looking for was, if I saw a patient of Dr. O'Boyle's because he was away or on vacation or unavailable, what would I do if the patient wanted to continue with me and not return to Dr. O'Boyle's care? The answer they were looking for was that I could not continue to see the patient, and if the patient did not want to return to Dr. O'Boyle, I could assist in referring the patient to another doctor, but under no circumstance could I continue to see Dr. O'Boyle's patient. Listings in the phone book at that time could not even be in bold print. Now, TV ads, billboards, newspapers, and radio all are soliciting patients, telling them how much better they are than anybody else, why their hospital is the best, why you should be seeing them instead of somebody else. Insurance companies and HMOs control who you see and what your treatment options are. Doctors Roy O'Boyle and I had an answering service run by Joe McAvoy's father and later his mother from their home. Later, my mother answered my phone and made appointments until she was 90 years old. Her two sisters in Russia were both doctors, and she considered herself smarter than either of them, so she never hesitated to give advice in the course of making appointments. I told her that when she gave advice on my phone, she was acting as my agent and I was liable for any advice she gave, but that didn't stop her. There was a time when my busy practice almost disappeared for a few weeks, and I couldn't figure it out until someone told me they had called my mother, and my mother said there were no appointments for several weeks, hoping they would go elsewhere. Then the patient, who knew my mother, said, "Is this Mrs. Grace?" And when she said yes, they talked and talked about how well she knew my father. And then my mother said, "Could you be here in an hour?" And she gave her an appointment. When I questioned my mother about why she wasn't giving out appointments, she said, "Do you remember a few weeks ago a doctor in his 30s dropped dead in his office in Southbridge? I decided to rest you." Two people important to my practice have been Cindy Hargraves, who has been with me for 34 years, and Roger LaFleur, who was with me for 20 years as a physician assistant, and then returned to UMass Medical for his MD degree. He is now at Mary Lane Hospital Emergency Department, where he continues to see many of our patients. In 1959, Mary Lane Hospital had its 50th anniversary. An invitation to the dinner that was held is part of the display. We had a fancy Cornish hen dinner with paper ruffles on the end of each leg. My wife at that time said, "This is raw." Mine tasted fine, and I said, "Shut up and eat it, it's fancy." When we were both just about finished, they announced that half of the hens had been pre-cooked and only needed to be warmed. The other half were in fact raw. Mine was cooked, hers was raw. I recall that may have come up in our divorce proceedings. During hospital accreditation inspections, the first question with reference to maternity services was, "What is your rate of cesarean deliveries?" If your rate was 1%, that is 1 per 100 deliveries, that was considered excellent, and they never checked anything further in the maternity unit. Now, anything less than 25% is almost considered reckless endangerment. No one is allowed to labor for several days anymore, but babies used to be born with what were called capots, or they looked like cone heads, from trying to fit through a pelvis that was really too small. As a small child, I used to hear that my sister Dora was born with 2 heads. I envisioned one sitting on each shoulder, but when I learned more about obstetrics, she had to have had a large caput, or cone head. Maybe that explains a little bit about Dora for those of you who know her. Maternity wards used to be a large part of inpatient hospital care, because when I started delivering in 1955, other doctors had patients dangling over the edge of the bed on the 5th day and going home on the 9th day. The maternity patients took up a lot of beds. At Tripler in Hawaii, our patients were going home in 2 or 3 days, and it wasn't too long after arriving at Mary Lane that this became the norm. The biggest growth spurt at Mary Lane Hospital has been since the 1980s. In 1959, at the time of the 50th anniversary, there were 12 doctors on the active staff and 20 part-time consultants. The 3 surgeons at Mary Lane were Dr. Harlan Ainger during the first half of the 20th century, and Dr. Bill Hallisey and Dr. Jose Pangan during the second half. In 1999, there were 165 doctors on staff. Dr. Bramble, now retired, and I are the only 2 left from that group of 12 in 1959. Dr. Bramble and Dr. O'Boyle were my role models. I was on the nominating committee for many years, mostly as chairman, and ended up as chief of staff for 2- and 3-year terms. No one ever wanted the job, and someone on the nominating committee usually had to end up taking it. The last time I was chief of staff, I received several congratulatory letters from patients, and I told one of them that it really wasn't an honor. You get it by default. And she said, "Don't you watch General Hospital? The chief of staff is everything." Longview Recording Studio has brought many famous people to North Brookfield. The Rolling Stones were here for a couple months in the fall of 1981 before their world tour, and Mick Jagger was in my office and walked around the grounds. Arlo Guthrie came to my office with abdominal pain because his also famous father died with Huntington's chorea, a severe fatal neurologic disease that hits people in their 30s. All Arlo had to do was sneeze, and everybody wanted to know if he had it too. It's actually called Woody Guthrie's disease. He was at Mary Lane Hospital the week that Elaine and I were Citizens of the Year for the Quabog Area Chamber of Commerce, and he allowed me to mention him at the dinner. The news was picked up by the national news agencies, and for months afterward, I received clippings from faraway places, including Hawaii, Alaska, California, and Texas, from former North Brookfield patients who saw it in the paper. Arlo has lived well beyond the age at which the disease would have begun to show signs. There is actually a genetic test that would have told him if he was going to get it, but he didn't want to have the test. Modern medicine and the unbelievable developments that have occurred really started in the 20th century. Prior to that time, there was not a lot of differences in the practice of medicine in 1800 and 1900, with only a few significant developments, like washing before surgery or obstetrical deliveries instead of after, to prevent infections. Aspirin is probably the greatest single medication ever developed. It is still the standard by which all pain medications are measured. It is the basis for the development of sulfa drugs and the first oral diabetes medications. Insulin in the 1920s and penicillin in the 1940s, just in time to treat World War II infections, were the biggest events in the first half of the 20th century. Smallpox vaccination started in the early 1800s, and tetanus immunizations in the 1900s, and diphtheria immunizations in 1935. I know because they sent a paper home from school when I was in the 3rd grade. If your mother wanted you to get the shot, she had to sign the paper and return it. I told them my mother said no. Polio, or infantile paralysis, was a dreaded disease with many deaths and severe crippling complications until the 1950s or early 60s, when a vaccine was developed. Now polio is a thing of the past, except for those living who got it 50 years ago. President Franklin D. Roosevelt was crippled by polio. Other vaccines followed for measles, mumps, German measles, chickenpox, hepatitis, flu, pneumonia, meningitis, and other diseases. Now kids get 24 shots by the time they're 5 years old and ready to start kindergarten. Some of the more outstanding advances in the past 50 years, and many only in the past 25 or less, include new medications for better control of diabetes, high blood pressure. There was no effective medicine to treat high blood pressure until the 1950s, starting with diuretics or fluid pills that reduced blood volume and eliminated salt. This is still the number one treatment in spite of about 5 or 6 other families of medicine for treatment of high blood pressure. From the 1960s to the late 1990s, taking the pill meant being on birth control. Now it means taking Viagra. Imaging studies for diagnosing consisted only of X-rays from their discovery in the 1890s until the 1960s or 70s. Now there are ultrasound, CT, and MRI scans. Patients now request or sometimes demand these studies even when they are not indicated. Surgery has also made big changes with laparoscopic surgery, where small incisions are made and operations performed through these small incisions. One of the best examples is gallbladder surgery. You used to have a near foot-long incision below your ribs on the right-hand side. You'd be in the hospital for a week or two and take months to recover. I had my gallbladder out in January, and I was home in 5 hours. Successful transplant surgery started in 1954 with identical twin Ronald Herrick giving Richard a kidney. They were from Rutland, and there's a clipping on display of Ronald 50 years later. There is no rejection problem between identical twins, but progress has been made in controlling rejection of organs from other than identical twins. Now heart, liver, lungs, pancreas, and intestine transplants are becoming more common all the time, limited only by the availability of donors. Research in transplanting of beta cells in the pancreas to produce the insulin not being produced by a patient's own pancreas is progressing. This is one of the many areas where embryonic stem cells probably hold the cure. Bypass surgery or stents, defibrillators, and pacemakers have dramatically changed the survival rate of heart patients. Joint replacement, hips, knees, and smaller joints is now everyday surgery done in community hospitals as well as medical centers. Lens implants for cataracts prevent inevitable blindness and dramatically improve vision. Laser surgery is used for many procedures that there was no treatment for just a few years ago. The numbers for cancer still aren't good enough. Earlier detection helps, but cure and even better preventions may be out there and we don't recognize them. Here in North Brookfield, we're only 60 miles from one of the most outstanding medical centers in the world. People travel thousands of miles to be treated in Boston, but everyone doesn't have to go to Boston for every condition. Worcester and Springfield are medical centers in their own right, and many problems are better handled in local community hospitals. Knowing what the newest technology is and where it is available is providing a service. Doctors don't do everything for everybody now as they did when there literally wasn't much that could be done. If I could start over, I wouldn't change anything. I'd still want to be in North Brookfield and have the type of practice I had. Years ago, no one would think anything of a hearse at my home because they frequently stopped for me to sign a death certificate. Also, an ambulance at my office was a common sight to take a patient to the hospital. Now, living in the barn behind my former office, an ambulance came one night about an emergency that needed me to call the state medical examiner in Boston. Within 5 minutes, people were ringing to see what was wrong with me. More serious is that my best friend, Eddie Messier, works part-time for Pillsbury Funeral Home, and sometimes he stops when he has the hearse. I have forbidden him to park in front of the barn. He has to park at the restaurant next door. Otherwise, people will think he's picking me up for my last ride. You all have a preview of my obituary picture here on display. A picture of the Gilbert Estate where Mary Lane Hospital was built. It's the one that was donated in 1919, along with the $500,000 to endow the hospital. The original Mary Lane Hospital, and next to it, the addition, and this was the hospital until 1923, when the first wing of Mary Lane was built. Yeah.
Okay.
And when I started practicing in 1955, this was how the hospital was, and you can see the first addition was here, which is this. So that was the hospital in 1955. This is groundbreaking for the newer additions to the hospital. And this is how the newer part of the hospital looks now. This is Jeanette Howland. And this is one of the bedside patient tables that I was sitting at during my talk. That Matt found in his attic. This is Dr. Ludden, right in the center here. You can see the Board of Registration in Medicine was established in 1894. And this was issued in 1894. It's a first-year issue. And that's Ronald Herrick. And that was in December of 2004, 50 years after he gave his brother Richard the kidney. Richard lived 10 or 12 years, after he got the kidney. This is my obituary picture. Over here is the letter with the law establishing the Board of Registration in Medicine. As I said, my mother got everything big, and 61 years later, I can still fit into that shirt.